Many patients ask me why I chose to become a plastic surgeon or a physician in general. I grew up in a medical home. My father was an anesthesiologist in a small town in Ohio. My mother was an OR nurse with lots of years of experience, so you can imagine the conversation around our dinner table was always about health-related issues, OR-related issues, and learned from an early age, what working in the hospital was like, and always had an interest in working in medicine. So when I went into medicine, it was sort of a natural feel for me. I have a whole family full of medical people. My father, my mother, multiple aunts are nurses. I have a brother who's a nurse. So that part of it was natural. The plastic surgery part of it, I became interested when I was doing my general surgery residency and rotated through a plastic surgeon's office, and it just so happened to be my partner, Dr. DeMars. At the time, I was thinking of doing something more along the lines of trauma and critical care, but I knew I wanted to be in a very hands-on part of medicine because I really felt like that's where I needed to be. So surgery, I love general surgery, but I gravitated toward plastics because I learned that in plastic surgery you could deal with all different types of patients. You could help patients who were very young children, struggling with congenital defects or, injuries that happen to small children, right up to people that are older and are trying to remain healthy and active. It's a wide spectrum of patients, both male and female, and it's just a great practice in that regard because you never get tired of it because there's so much variety that comes along with it, and it is a very hands-on type of surgical practice. It's a type of surgical practice where you really have to be involved directly with your patient, and you really have to have that human interaction, that rapport with your patient. There is a stereotype of surgeons as being aloof and not being very personable, and I'm sure that back in the day that was the standard general surgeon maybe was like that. I certainly had some instructors that were like that, some attendings. But by and large, I think plastic surgery, more than any other surgical discipline, it's always been said it's the surgery of the psyche. You have to understand the patient, what they're thinking, what is bothering them, what concerns them, and you can't do that unless you're able to talk to them and relate to them as a person one-to-one. So that aspect of it has always appealed to me, and it still does to this day. It's really enjoyable to work with people to really try to help them to reach their goals in the best way that I can. So very rewarding.